Hello everyone. It is May 27th. I'll tell you what, I've got a couple of really good topics that I think are going to be very interesting to discuss today, and I really would encourage you to join our conversation. You might have a question for our guest, you might have a comment. Don't hesitate to call 547-8726. So the two topics we're going to talk about today, one has to do with healthcare in the Tri-Cities. And, you know, the Affordable Care Act went into, or the President signed that in 2010. So now it's 2015. We've got some experience under our belt. And I thought it would be really interesting to invite a guest here who operates a program that is specifically designed to provide health care for people who are uninsured, to see what kinds of things they have seen that are any different. Any positive changes, any problems. So we'll learn a lot there. Then also we've invited someone from the juvenile justice system. She's a court commissioner. She'll be able to talk with us about the truancy program and also the youth at risk program. And I think you'll find both of them very interesting in how these tools can help parents. All right, first off, let's talk about affordable care. The agency that I'm talking about is Grace Clinic. The CEO of that program is Mark Brault. Mark, thanks so much for joining us today.
My pleasure.
I appreciate it. Yeah. So the bottom line is I want to know what kinds of differences you have seen. And granted, this is only a little microcosm. We're going to zero down on your program, and that's all. We're not looking at the whole Affordable Care Act in the Tri-Cities. But I think that what is happening at your agency could give us some glimmer. So first of all, what are the circumstances in which people will come to you for health care?
Well, the clinic, which is about to celebrate its 13th birthday,
Wow.
takes care of residents of Benton and Franklin counties who have limited income and no insurance. That's the fundamental eligibility criteria that we have. So we're dealing completely with an uninsured population. We've seen that we know of about 150 people, former patients of ours, who've gotten coverage. We know that there are undoubtedly more that we just don't know about. But we have an active patient list of between 3,000 and 4,000, and we've seen that we know about 150 who've gotten coverage. Almost all of that through the expansion of Medicaid.
So we're talking 150 out of 4,000?
Well, like I say, there are undoubtedly some that we don't know about.
Okay.
But
Okay.
It's not a huge number.
Okay. And do you serve anyone that walks in the door that meets that basic criteria? So, to me, that means you're also serving people who are undocumented, correct? You don't ask that question.
We don't ask the question. If they meet, we have a small set of eligibility criteria. The first is that you don't have insurance. The second is that you live in Benton and Franklin counties or Burbank. We consider that to be the community. And the third is that household income is at or below 200% of the poverty level. And then there's a fourth criteria. It's not really an eligibility criteria. It's that what the individual needs is something that we can provide. You know, there's a limited scope to what we can do. So occasionally we have people who come to us who have a need that's outside the scope of what we can do. But if it's a service we can provide and they meet those eligibility criteria, we take care of them. We don't ask the question of whether they're here legally or not. It's not relevant to what we do.
Okay. So since you're not turning payment requests over to insurance companies, how do you get paid? How do you stay alive? How do you keep those doors open?
The clinic is completely a community effort. All of our funding comes out of the community. We get support from United Way, from businesses, individuals, churches, service clubs. We don't get any government funding. We're strictly supported by the community, and we're operated primarily by volunteers. So all of our volunteers come out of the community, with one exception. We actually have a dentist who about 7 months out of the year travels one Saturday a month from Seattle and sees our patients. But we're really a community effort.
Okay. And why do people come to you? I mean, what are their ailments?
It's anything and everything that you can imagine. We do a mix of what you would generally consider to be urgent care, people who have an upper respiratory infection, have some kind of infection that needs to be treated. And we also do a substantial amount of chronic care. We see a lot of people with diabetes, hypertension, asthma that we generally see on an ongoing basis. So most things that you'd find in an urgent care setting or a primary care setting are the kinds of things that we do.
Okay, and so what do you not do? I mean, do you have x-ray, for example?
No, we don't do x-ray. We do have the ability to access that through one of the hospitals, but we don't do x-ray on site. We do lab work. We have a great relationship with Tri-City Labs, who actually does the work for us.
Okay, so 13 years ago, Grace Clinic was basically created because people who are uninsured were putting a tremendous burden on the basic services in the Tri-Cities area. Isn't that fair?
Well, that certainly was the case. You know, what happened is a couple of local physicians had been on a medical mission to Central America. They were back talking about their experience and said, you know, what if we could do something in the Tri-Cities kind of like what we did in Honduras? That was in December 13 years ago, and 6 months later, June of 2002, the clinic got started seeing patients for 4 hours on Saturday in the basement of the little Methodist church in downtown Pasco. So we started out seeing patients for 4 hours every Saturday. Today we see them 4 days a week. We've grown the scope of what we do. We've added dental, mental health. We have our own pharmacy. So the size and the scope of what we do has grown pretty dramatically over those 13 years.
Okay, so the Affordable Care Act came on the scene, and it was to substantially reduce the number of people who were uninsured and having access to health care. And if I look at your stats or what you're telling me, that really has not affected what you're doing at all.
Well, it's affected us. You know, the number that we know of that have gotten insurance is without a doubt understated.
And are those people paying for coverage or partial payment, or have they become eligible for the Medicaid program?
If you look at what's happened, the original expectation when the law was passed was that the reduction in uninsured was going to be pretty much equal between those who became eligible for Medicaid under the new rules and those who would be eligible for subsidized health insurance. Experience in this community and statewide is nothing like that. Out of 10 people who have gotten coverage, 9 out of 10 have gotten it through Medicaid expansion in this state and certainly in this community. Mm-hmm. So we've seen relatively small numbers who have gotten subsidized coverage. The vast majority of the people who have gotten coverage are covered by Medicaid.
All right. And a lot of people were uninsured in the first place because they didn't have the money. I mean, they didn't have the money to contribute to their health care.
Right, and that's the reason, yeah, honestly, that most of the people who've gotten coverage have done so through Medicaid, because there's no cost to the individual for Medicaid. For those who are eligible for a subsidy, for the vast majority of them, the reality is that the subsidy makes coverage more affordable, but not actually affordable. Mm-hmm. Because they still have a premium they have to make that's often outside the scope of what they can afford. And then there are substantial deductibles and copays beyond that, so the out-of-pocket costs are fairly substantial.
Yeah. People have to really pay attention. I mean, it's not something that's just blanket and just there. I mean, you really do have to pay attention to what you're getting.
You absolutely have
responsibility.
To pay attention. That's right.
Yeah. All right, I'll tell you what, Mark, we're going to take a break right now, but we do have more questions for you. If you want to join our conversation, here's the number, 509-547-8726. We're talking about the Affordable Care Act today and one little microcosm of it and how it affects Grace Clinic in the Tri-Cities. Stay with us. This is News Talk 870. Welcome back to Meet in the Middle. I'm Christine Brown. We're talking about the Affordable Care Act, how Grace Clinic in the Tri-Cities interacts with that. Our guest is Mark Brault. He's the CEO. Grace Clinic, as a reminder, is a service set up in the Tri-Cities that's been operating now for 13 years, and it is specifically to help people who have no insurance. So if they need medical care, that is a way for them to get medical care. One of the objectives of the Affordable Care Act was to get a lot more people involved in preventable health issues, and get preventable health care. Do you see any of that happening? Are we moving towards that at all?
Well, you know, under the law, all plans are required to cover prevention.
Mm-hmm.
You know, they cover an annual physical and a number of those kinds of things. So if you have coverage, it makes getting access to those things easier because there's no out-of-pocket cost. It's not really what we see because we're dealing with an uninsured population. They're coming for whatever the need is that they have at the time. But I'm sure that in the community in general, we've seen an increase in people asking for those services because they're now all covered.
Okay, so for the population that you are still serving, they're coming, the preventable stuff has gone by the wayside. They're actually now in a full-blown problem.
Virtually everybody who comes to us comes because they have some specific need, and in some cases that's an acute need, upper respiratory infection, something like that. In a lot of cases it's because they have a chronic disease like diabetes and they need to be seen over an extended period of time on an ongoing basis.
Mm-hmm. So you're involved in the general healthcare system, even though your specific patient load is they're not insured. What have been your observations? What have you seen? What have you heard in our community where the Affordable Care Act is working and improving the lives of people?
Well, there are two or three things that are reasonably clear to me. The first is we have seen a number of people in this community. The most recent data from the exchange says that about 19,000 people have gotten coverage under Medicaid. Now, some of those may have had some prior coverage. All we know is how many enrolled under the new rules. So for those who did not have coverage, that gives them greater access. If they were patients of ours, being covered by Medicaid gives them greater access to services because they now have an ability to pay for things that are outside the scope of what we can do. Mm-hmm. And fortunately, in this community, and this is not the case statewide and certainly not nationwide, in this community we have pretty good access for Medicaid patients. Most of the hospital and clinics do not put any real restrictions on the number of Medicaid patients they'll see. Tri-Cities Community Health doesn't see a lot of Medicaid patients. So we have good access for people with Medicaid. For those that have gotten subsidized coverage, access is okay. There are a number of challenges that we've seen. Most of those plans have relatively high deductibles. And you know, people who are getting subsidies don't make a lot of money and often have deductibles that are run $3,000–4,000. Okay? That's significant.
Oh.
The other thing that's the case is that in those plans, and some of this exists in most plans, but in those plans in particular, the insurance companies have done things to try and control their costs, and so you see a need for referrals for specialty care that's very tightly controlled. You see a lot of prior authorizations required for certain medications. So the clinicians end up spending more time jumping through hoops mm-hmm. in order to be able to deliver care.
Mm-hmm. And so, I don't know, it seems to me a broken record. The people that are just like in the middle, they're not affluent enough to have their company pay their insurance. They're the biggest portion of their insurance, so they're not that group. They're not the group that's poor enough to have Medicaid coverage. They're the people right in the middle that once again just get squeezed. So I wonder, how have we helped that group?
We haven't helped that group very much.
Oh.
You know, in the clinic, we use 200% of the poverty level as the upper end of our income eligibility.
Oh, what does that mean? I mean, when people throw that out, I don't know what that means.
Well,
give me the math.
The math depends on family size.
So a family of four, two children, two parents.
A family of four is about $44,000 a year at 200% of the poverty level. At 200% of the poverty level, the subsidy is designed to be enough so that the net cost for the individual is 6.3% of their gross income. Okay? Now, when you don't make a lot of money, 6.3% of your gross income is significant.
Yeah.
And consequently, for a lot of those folks, the subsidy makes coverage more affordable, but not actually affordable. Mm-hmm. And so I'm I'm speculating, I think I'm right, that at the lower income levels, the vast majority of the people who have gotten subsidized coverage have done so because they have a significant medical need. They have the greatest motivation to figure out how to come up with a premium, to figure out how to pay for their portion of it. If they don't have a big need, it's too big a bite, particularly when you've got the premium and then the out-of-pocket costs. They just say, I can't afford it.
Yeah. Well, I wanted to share with people that there's a lot of discussion going on right now about the issue of the Affordable Care Act in the Supreme Court, and that decision from the court will come out soon. And basically, it's not going to affect Washington, the state of Washington, at all, is it?
Right. The court case has to do with some language in the law that pertains to eligibility for the subsidies, and the precise language says that people are eligible for a subsidy if they get their coverage through an exchange established by the state. Many of the states, most of the states, relied on the federal government to establish the exchange. The state of Washington did its own. So therefore, if the Supreme Court rules against, then that will be an issue in the states that did not develop an exchange. Washington did, so it's not an issue here.
Okay. All right. I'm going to give you the phone number again if you want to join our conversation. 547-8726. All right. I'm winding down with my questions here, but here's another one. So what would you identify as maybe the top two things that could improve the existing law from your point of view?
Boy, I don't know. That's a really tough question because depending upon how you measure it, if you look at the impact of the law and say we've gotten people covered, we've gotten a number of people covered, that's a good thing. We're not anywhere near addressing solving the problem for the majority of people.
For the majority of people who were uninsured to begin with. Okay.
Right.
Okay.
The best data in Washington State says that the number of uninsured has declined by about 35%. So that's improvement over where we were. It puts us at about where we were in 2008. Okay. We have about the same number of uninsured as we did in 2008. But to get the rest requires funding it in a different fashion, and that's a major hurdle. Healthcare is expensive.
Yes, it is.
But there's some data that seems to indicate that ER use has increased. Much of that related to the new Medicaid enrollees, who now have coverage, and therefore going to the ER is less of an obstacle than it was before they had coverage. But we don't, at least not that I've seen, we don't have enough data that really answers that question yet.
All right. Well, there's a lot more to learn, obviously, but you have added to our knowledge base here. We haven't really seen that many pictures about what is happening in the Tri-Cities area with the Affordable Care Act. So you filled in some of the blank spots for us, Mark. I really appreciate that with Grace Clinic. Good luck to you.
Thank you.
Thank you.